In this training video, I'm going to go over clinical workflow enhancements. I will apologize up front. I'm going to move around quite a few charts just to show you all the new enhancements or features that might bring some efficiency to your workflow. The first thing that's new is this contagion risk link. You may not have a need for it, but what we did find that was helpful here, if you click on the link, you can reach the cdc.gov website pretty easily. And also, if you were using this link or just wanted information about a contagion exposure, I could click on one of the topics to the left, and then if I were to click on this web link, if it was accessible, it would actually take me to that topic in the CDC, on the CDC webpage. Next is a new the medication reconciliation button, which is still accessible from intake and finalize. So in intake, the medications reconciled button is available at the top of the panel, but it has also been added to your medication module. And it's right up here at the top. So just another place to note that medications have been reconciled. Next, I'm going to move on to the allergies module from the intake tab of a office visit workflow. And here I'm going to go to update. What you can do now with allergies is you can still add up to 5 reactions to an allergy, but you can also attach a severity to each reaction you add. So I will demonstrate this. I'm going to add a new allergy for this patient. And I'm going to click add to add my reactions. And from here you'll see it gives me a new pop-up where I used to just scroll within the main template. And from here I can select a reaction, and then it's also wanting me to select severity. So I can say moderate to severe, and will add that to this allergies reactions. I can still add up to 5. And again, I can attach a severity to that reaction also. And I can also remove from here if I needed to. So I'm going to click OK there, and you'll see that those pull forward into the reactions field. I can always edit what I've already added again, and it's going to allow me to edit the severity that's been attached to a reaction. So I'm going to click Add, and then close this pop-up. And you'll see those reactions with the severity in parentheses have been added to the allergies panel. And if I were to hover over allergies in the patient info bar, you'll see the severity also attaches to the reaction. Here, this is where I'm going to jump around a bit. I'm going to go to the histories panel. And in the social histories panel now, this page has been reorganized into a panel view, what's nice about this is you can now go through each section and make any edits or documentation and move on to the next before clicking OK and closing out of this window. You'll also notice a brand new section for vaping use. And this has been added in this upgrade. I'm going to move on now to the patient education browser. So what's nice about the patient education browser in this upgrade, previously you would have to access the patient education through the file menu. That has now been added to your left-hand navigation, and it's a patient education button. From this menu, you'll see things look a little bit different. They've made some enhancements. The first is this upper left portion, which is called recommended search criteria. What's nice about this new section is this is pulling in from the patient's chart their chronic problems, their allergies, and their medications. What you're able to do in this version now, I can click on anything in this window and it's going to pull in patient education documents if they exist in this browser. One thing to know especially with the problem list, if you have diagnoses listed that are extremely specific. It may not pull anything forward in this patient education browser. It really does work best when there's a fairly generic uh, a fairly generic diagnosis code listed. But it will bring in this menu at the top that will include everything within this that meets that search parameter. So it's searching just for depression, and these are all the documents that found. You will still have the original directory below to search by any of the conditions or topics listed, and you still have the search window to free text in any search criteria. So this is just added functionality, gives you search results based on what's in the patient's chart. One new feature that's really, really cool is the ability to add documents to your cart. So if this is a document, I'm seeing it in my preview pane that I wanted to select, I can select this document here, and you'll see it added down to a queue below as a selected document. So depending on what the item is, I can select an item or click just to preview and then click here in the checkbox to actually select it. So this below is now my cart. This is my patient education cart. If I wanted to save all of these documents at one time and attach them to the encounter, I can do save to encounter, or I could even send multiple documents to the patient portal at one time or print. So the cart is essentially allowing you to select multiple documents at one time to take action on. Previously, you would have to exit the browser, go back in, do a new search, attach a new document, and now you can build a queue and save or send at one time. So I'm going to exit out of there. And next we're going to go to the navigation menu again because there's a new change to the screening tools. In the screening tools, you now have the GAD-7, the generalized anxiety disorder screening tool, available in your screening menu. One change I will mention, it doesn't involve opening the module, but in the immunizations module, the rules have been updated. Most obvious is the inclusion of HPV as a two vaccine series option if given before age 15. So there's been some immunization rules on the back end that you will see applied in the immunization module. The next feature I'm going to go back to the SOAP tab. And I'm going to scroll down to the assessment and plan. And you'll notice this new button called DX-AP History. So it's your diagnosis and assessment plan history. What this allows you to do, I'm going to click on this button. What this allows you to do is copy forward a previous visit note. So I can select, this is pulling in the patient's history of diagnoses and assessments and plans. And I can select a previous one and copy it into today's encounter. So for example, this one that already has the assessment attached, a patient plan, and the provider details. If I select copy DXAP, that information will pull into today's encounter. Then to exit this menu, if I were now done, I would have to X out of it. And you'll see that that information now exists within the assessment and plan. One thing to know here, if you are planning on using this feature, maybe the patient's here for an assessment you see them for often, you would want to use this functionality prior to adding an assessment on its own. So if they were coming back for this same diagnosis and you've seen them for it before, you would want to use this function and add this in, because then you can actually click on the plan and update and edit if you need to. One other thing to note is if you are carrying forward or planning to carry forward, just know that at this time the copy forward functionality isn't working for ICD-9 codes. So if you are trying to carry forward an assessment that's really old, it won't work. It will look as if it's saved, but it will just sit there. It won't actually pull forward into your encounter. Next, and this is just a minor change, I've pulled it in. There's a new abnormal PAP HPI which you can find by typing in abnormal pap in the other field to search for it, and it is giving you the lab order results and then a pap screening pop up. There have been some additions to the procedures, and I'm not going to go into each one. I will just call out what the new procedure templates are. So there's a new diaphragm and cervical cap procedure template. There is a new subdermal contraceptive implant procedure template. There is a new external genitalia and testosterone pellets, which is here. Procedures that have been updated. There's been some minor updates on the IUD template, colposcopy, and the endometrial biopsy. And there are also some new office visit templates. So I will bounce around a little bit. I'm going to go up to this encounter I've already opened up above. The OB postpartum template is changed. Within that template, the postpartum check HPI has been updated, and also the physical exam, the postpartum exam. Next, I'm going to open a pediatric patient. There's been an update to the well child office visit template. So there is a new well child soap. It is attached to the well child visit type, so when users come in after the upgrade and open a well child visit type, you'll note the soap is a well child soap. There's also a new well child HPI, which has been added to the reason for visit at the very top of your menu selections. And it is a fairly extensive well child HPI, which I go into further in a different training video. And that is the end of this training session.